Hello and welcome. Today we're chatting to Daniel Swift, who's pharmacist at Well at Roundhouse Medical Centre. Hi Daniel, thanks for chatting with me today. We just want to take a bit of time to help anybody who's watching this get a better appreciation for how they might want to think about offering the pharmacy contraception service and any sort of top tips and things that you can share. I know you've been delivering it for some time now. Could you just tell the people watching how it works in your pharmacy? How do you deliver the service?
Yeah, so we do a couple of different things. So anybody that's bringing prescriptions for contraception at handout, we use the CPE handout slips to prompt a patient to let them know that next time they need a supply they can contact us directly. We've got our phone number on there. Also we reach out to local GP surgeries. Some of them have long wait lists for nurse appointments, so letting them know that we can offer the service. We've attended a few clinical meetings as well to let the practices know that they can send us NHS email or just verbally refer patients for contraception service.
Okay, great, thanks. And before you sort of really got off the ground with it, what sort of steps did you take in the pharmacy to get you and the team ready for delivering the service?
So I briefed my team on the service. We use the CPE consultation questionnaires to help streamline the service. We do offer a booking system, so we've got a few different services that we offer. So we do book patients in, so they've got some determined time when they can come in, but we do offer walk-in as well. So some people really appreciate the walk-in service. It's much more accessible.
And how's the you sort of said there about the sort of walk-in being more accessible, but for those people that are booking in, have you had any feedback about what their thoughts have been using a booking system to come to a pharmacy?
I think we do quite a lot of different services, so it's not completely novel to our pharmacy. We've got a lot of different private and NHS services that we offer. Generally patients like that they can come to us a little bit later. They're not having to make appointments too far in advance. Usually same day or next day. Some patients prefer to make it on the day off or a week before, but usually it's fairly short notice.
Yeah, okay, so really convenient for people by the sounds of it as well.
Yeah.
And you said that you're delivering other services. How do you sort of manage all the services on top of being, you know, a typical community pharmacy in a health centre setting? How does that work for you?
Well, what's important for me is making sure that we use maximum use of the support staff. So we have checker, so we have hub and spoke model, fortunately. But also the services can be provided by other members of the team, so hypertension, so fitting ABPMs, clinic checks, they're all done by other members of the team. Things like flu as well, that's also delivered by most members of the team, so as much as we can delegate, we do delegate, and the things that only I can do as a pharmacist to try to do those to give the best patient outcomes.
Yeah, great, and lovely to hear that example of how you're using the rest of the team to support service delivery. In terms of thinking about sort of working with other healthcare professionals like GPs or maybe sexual health providers, what have you sort of got any systems in place, anything that you've done to sort of help support formal referrals to you for the contraception service?
Yeah, so I visited the clinical meeting at one of the practices in person. I've attended one virtually. It's not always possible to get out to the practice to give them an overview of the service. Always promote having some sort of some electronic referral, just so there's a log. They can sort of look back that we've actioned it, so we always reply with the response so that they know the patient's being referred to us, that we've acknowledged it, and then the patient's being booked in, and then they get a notification via Farm Refer. I have contacted the local sexual health clinic as well to let them know that the services that we can offer that can complement some of their offerings as well. So when patients get to the age of 25, they usually refer back to the GP to let them know that we can take over treatment for those patients as well.
Brilliant. And what has worked well for you in terms of linking up with some of those other services like the GPs and the sexual health providers? Have you got any sort of top tips that you could share with anybody who's watching this as to what you think has worked well, or what would you do differently if you were doing it again?
I think it's important with a practice to discuss the offerings that we have got, so the different services, different aspects of the service might be beneficial to a practice. So for instance, if they're long wait times for a nurse, then freeing up contraception time would help them. Sometimes even if it's just a desogestrel consultation, it's saving them a few tasks. Usually it's a questionnaire that's sent out, so they have to send that out and then they have to get the form back and then they action it. So it's a couple of less tasks for them in their inbox, so probably not saving them too much time, but a few less tasks always helpful, I think, on the end of the day. So not having to clear it down. Reducing the amount of time that patients are waiting, so sometimes it could be 4 or 6 weeks for a nurse's appointment. If it's GP availability, then pharmacy first. If they're referring patients to us electronically, then we can deal with lots of different services, triaging some patients for minor ailments as well, giving them some advice.
Okay, so what I'm hearing there is it's really good to have a bit of a hook for why it would be beneficial for them to work with you and offload some of that contraception work towards the pharmacy.
Yeah, it does help. So things like with the hypertension, there's a lot in the QOF this year for hypertension, so blood pressure checks, and following up on high readings. So it's mutually beneficial that they need this work doing, and it's a service that we're able to offer quite freely as well. So no appointments really for hypertension, blood pressure check. You can just walk in, usually fit them in at any point. ABPMs, we do an appointment system, so we can usually book people in next day or the day after, so it's usually only in a few days' notice and it's straight back to the practice.
Okay, great. And in terms of what has the patient experience been of offering the pharmacy contraception service, so have you had any sort of feedback that you could share with people watching this?
I think of all the services we do, it's the universally positive message that we get from patients. Accessibility, the time to sort of sit down, have a conversation. Sometimes if patients are having some side effects or they don't necessarily have face-to-face with the nurse every time, even sort of missed pill advice, so some people are a bit surprised about some of the missed pill advice that they should be following, but generally it's been very positive.
Brilliant. What challenges have you experienced in delivering the pharmacy contraception service?
I think the challenge to start with is getting over the barriers that patients expect to go into the practice to have some of these services. So just explaining how they work. Some practices work slightly differently, so in terms of how much they supply at a time, so some practices do 6 months, some do 12, so we're trying to align ourselves with what the practice is doing so patients are getting a consistent service. Equally, some practices, even for desogestrel, like to capture blood pressure, height and weight, so if patients are happy to do that, we will send that through in the consultation as well, even though it's not part of the farm outcomes module. We put into the notes section at the end, and that just gives them some reassurance that we're working collaboratively and they will send us more referrals in turn.
Yeah, so a little bit of a challenge there in terms of keeping up with the different practices and their ways of working around sort of managing contraceptives and in their system.
Yeah, exactly. I think sometimes losing the control can be a concern, so working with them and addressing those concerns, getting feedback on how it's working.
So keep going back, not just do one.
Yeah, it's not just a one-off thing, we're constantly in contact.
Yeah, great. And what has this meant for you personally? So, you know, what sort of opportunities or what impact has this had on you and the team in your pharmacy and, you know, the community that access your pharmacy?
I think it's much more rewarding personally. I'm getting to use my knowledge more to give patients a better outcome. For practices, it's freeing up their time so they can see more complex patients. For my team, that they're also seeing that they can help patients, especially in terms of hypertension. We've had many instances where they've captured some really high blood pressure readings and really making a contribution to patients' lives, which is very rewarding.
So if you had to give a top tip or a key piece of advice to somebody who's maybe just starting off thinking about delivering the pharmacy contraception service, what would that be?
I think to plan ahead, have things out, look through the farm outcomes modules so you know the types of things that you're looking for. Maybe have a trial patient, so if you've got a member of staff that maybe uses contraceptive, if they're happy to be a bit of a guinea pig, just so it's not the first time when you go onto the farm outcomes with a real patient, you've gone through it already.
Yeah, brilliant. Great pieces of advice there. Daniel, thank you so much for chatting to us today, and hopefully that's also given anybody watching this a few useful top tips and pieces of advice to think about how you can implement the pharmacy contraception service in your practice.